mynews.studio.
Under the Kalahari sun, Botswana has nearly erased mother-to-child HIV transmission. What's actually driven this turnaround?
Today's date is August 30th, 2025. If we look back, Botswana was once facing an overwhelming HIV epidemic. In the early 2000s, almost 40% of babies born to HIV-positive mothers were infected. Now that number is less than 1%. How did things shift so dramatically?
The scale of the change is remarkable. Now, fewer than 100 HIV-positive infants are born each year in Botswana. Compare that to thousands just a couple decades ago. Every new case is tracked, investigated. But this progress didn't happen overnight. Can we talk about where Botswana started?
It started with strong political will. The government treated HIV as an emergency. They invested heavily in health infrastructure and made sure healthcare workers were trained. Most importantly, they prioritized getting antiretroviral therapy to pregnant women.
Even in rural clinics, right? That outreach went beyond hospitals. Community health workers, civil society groups, they all had a part. Addressing stigma was huge. Women weren't always eager to get tested or treated during pregnancy. How do you actually change that mindset?
You have to make it local. Peer mothers, other women living with HIV, were trained to support their peers. They teamed up with midwives and nurses so that testing and treatment became a routine part of maternal care. It stopped being hidden and just became normal.
But it wasn't only about the medication. Public health campaigns pushed for partner testing, addressed myths, and encouraged people to stick with treatment. Community buy-in really mattered. International partners played a part too. I think?
Definitely. Organizations like WHO, UNICEF, and UNAIDS offered technical guidance. Botswana also joined the Triple Elimination Initiative, which targets not just HIV, but also syphilis and hepatitis B in mothers and babies. Donors like USAID funded early programs and digital tools for tracking cases. Still, the real shift came when Botswana's own government took over funding and leadership.
That's crucial. They made maternity care free for everyone, even those who aren't citizens. Universal ART was rolled out and digital health records became standard. When outside funding slowed, Botswana kept the programs going with their own resources.
Challenges remain. Some international donors are stepping back, so Botswana needs to sustain this with domestic funding. There's also the challenge of keeping mothers and babies in care, stopping new infections, and expanding digital health tools.
And stigma isn't gone. Some women are still hesitant to get tested or worry about discrimination. Keeping health workers trained and the public informed, that's ongoing work.
So the big question, can other countries do this? Botswana's shown what's possible, even with limited resources. It looks like a mix of committed leadership, science, and local engagement. But can that actually be repeated elsewhere?
It's more a model than a universal recipe. Still, the core lessons, investing in people, adapting to local needs, not depending only on external support, those travel well. Botswana proves near elimination can be done.
And it's a warning, too. Progress can stall if there's complacency, or if funding drops, or if programs don't adapt. The fight's not over, but the path forward is clearer.
Botswana's journey shows what's possible and what remains at stake. Thanks for joining us as we looked at this milestone in global health.
Thank you for listening. This episode is brought to you by mynews.studio. You can try it now for free.